My name is Dr. Andrew Menatti. I'm a board-certified clinical neuropsychologist, and I'm the director at the St. Louis Center for Cognitive Health. My expertise is in working with young adults through geriatric populations on issues related to some aspect of their cognition or their thinking abilities. Patients that I'm most passionate about working with are typically presenting with concerns related to traumatic brain injuries, stroke, ADHD, or dementia. The way I approach neuropsychological assessment is through a rehabilitation framework. What that means is I typically approach assessments with the view of trying to get people back to their highest level of cognitive potential. The thing I like most about neuropsych assessments is giving feedback and results to families. This is typically the time after patients have put in a lot of time and effort into working through their examination process, and it provides me a lot of meaning and a lot of joy to be able to share those results with patients. No matter how confusing or complex a presenting concern might be, we're typically able to provide some degree of clarity and certainty surrounding whether it be the diagnosis or the prognosis or recommendations for how to move forward. The neuropsych assessments that we do here at St. Louis Center for Cognitive Health are evidence-based and are provided by clinical neuropsychologists, some of whom are board certified by the American Board of Professional Psychology. I feel it's really important when you're seeking a psychological or a neuropsychological assessment to get an evaluation done that is performed by a competent professional. Typically, this is either a clinical psychologist or a clinical neuropsychologist. The main difference between clinical psychology and clinical neuropsychology is that clinical neuropsychology typically involves a fairly intense training residency focusing on brain and behavior relationships. Working with a neuropsychologist can be very helpful in instances where the complaints that the patient has are very complex or very difficult to pin down, or if there are a lot of medical comorbidities occurring.